Apple leader Steve Jobs died yesterday. An official cause of death has not been released, but Jobs had been battling pancreatic cancer for 7 years, and now many people are asking questions about the disease. Dr. Gregory Echt joins us now in the studio. He's an oncologist at Choice Cancer Care, and the founder of the Michael C. Sandler and Peter Kenner Cancer Foundation, dedicated to raising awareness about pancreatic cancer. First, doctor, thanks so much for being here.
Thank you.
This disease actually has touched you personally. Tell us why you started the foundation in the first place.
Well, I'm a cancer specialist, so we take care of the public, and I do radiation therapy in particular. But my wife and I had two very dear friends, Michael Sandler and Peter Kenner, that were diagnosed 3 and 1 years ago of pancreatic cancer, and both of them died quickly of the disease. And so we just wanted to do something to give back because the outcomes are so dismal with it.
Right. Well, we thank you for being here to bring awareness about it. What are the signs and the symptoms of pancreatic cancer?
Well, patients present with jaundice, their skin gets yellow, or their eyeballs get yellow, or their urine gets really dark, or they have nausea, or a lot of abdominal pain, or a lot of weight loss.
Okay. And how does pancreatic cancer form and then react once it's in the body?
Well, pancreatic cancer is a tumor. It's in the pancreas, and your pancreas is in your abdomen. And so the tumor can occur any place in the abdomen. And Mr. Jobs had a kind of an endocrine type of cancer. It's very complicated, which is an unusual variant. Most people get an exocrine type of cancer, and those patients don't live very long. His was a lower grade type, and it smoldered along for a while before it ended up taking his life.
Yeah, but it sounds like in some cases it's aggressive. In his case, wasn't. He probably had the ability to treat it as better than the average person.
Well, he's very private. I think originally they did limited surgery, and then it came back, and then they tried some chemotherapy and radiation. Then he had a liver transplant, and he ended up dying of disease thereafter.
All right, talk to us about risk factors. What are the risk factors? Because it's different for every cancer for the most part.
Well, I mean, smoking can be a risk factor. You can have genetic risk factors for pancreatic cancer. Sometimes drinking may be a risk factor.
Okay, and it's aggressive, it can be scary, it just moves so fast into people's lives. Talk to us about research. What's happening to find out more about a cause and a treatment?
Okay, so all told, if there's 43,000 Americans diagnosed each year of pancreatic cancer, 38 to 39,000 of them are dead in a year to year and a half.
Wow.
We're not doing well at all. And the patients come to us and we can treat them with surgery, chemotherapy, and radiation. If you can get it early, you can do well. But the problem is, due to the natural history of the disease and where it's located, patients present when it's too far along to get good outcomes. What we'd like to do with the foundation is back and fund basic research projects to make the diagnosis early. If we can find the disease early, it'll lead to very good outcomes, and we think that's where the money's at, and we're going to try to do that on the public's behalf.
Okay, the timing so key. Dr. Gregory Echt with the Choice Cancer Care, founder of the Michael C. Sandler and Peter Kenner Cancer Foundation. Thanks so much for your time.
Honor. Thank you. Okay. Thanks for having me.
Good to see you.
Thank you. You bet.